Welcome to our session on redesigning healthcare with women in mind and going from ambition to action. My name is Paula Bellostas Muguerza and I'm a partner with Kearney sitting in our London office. Why are we here with you today? We want to talk to you about women's health, both about the issues that are out there today, but also about the opportunity that addressing and closing the women's health gap represents for us individuals and for society as a whole. We're going to be doing things a little bit differently in this session. I think you're used to a lot of talks and a lot of panels, and today is going to be a bit of storytelling of why we started worrying and working on this topic, the journey that we have been on so far, some voices from some very interesting individuals working in this space, and critically, what's going to happen next and how you can get involved. So let's speak a little bit about women's health, both the problem and the opportunity, and why we started to look into it. From diagnostic rates to level of investment to the level of satisfaction and outcomes with the healthcare system. When you look across the globe, there is a fundamental inequity where both the experience and the health outcomes of women and men going through the healthcare system are significantly different. Women are significantly worse off. So we started to explore this over the years in our Kearney work, working on fertility, working on women's health, working on gynecological treatments. But most recently, we had the opportunity of bringing all of our thinking and all of our body of work together at the FemTechnology Summit with FemTechnology and Oriana Kraft, our partners. It was a fascinating summit that took place in 2023, in June, where tens of innovators came together to have a look at different topics that affect women's health, from funding to education and advocacy to women-centric cancer care. And we had the opportunity to take an end-to-end look at the problem and the opportunity. How can we truly redesign healthcare with women in mind? And we run some fascinating sessions with all of these innovators to really pinpoint what are the key areas of the problem, again, from societal bias to the level of investment, to research and development, to kind of care pathways that are generally not built with women at the core, but also started to think about some of the solutions and the role that the different players in the healthcare ecosystem and beyond can take to tackle this. The ask coming out of the FemTechnology Summit in Oriana was to publish a white paper. But I think both you and I know that nobody reads white papers anymore. So we needed to go from what was a very academic exercise into action. How do we actually start to mobilize a community that can change things? So a very small team decided, let's start to reach out to our network, to our client network, to our friends, our family, and see if they want to become part of this movement and sign what ended up being an open letter backed by a report that had all of the data and all of the stats and all of the facts about why this is a really significant problem, but also an amazing opportunity for us all. And from something very small, started to kind of gather momentum. And this really incredible snowball started to pick up pace. And we found ourselves with 50 plus organizations wanting to be part of this village. And with this momentum behind us, we decided what best than to take our message to the World Economic Forum and the big world stage that is Davos to say, we have a problem at the core of every single healthcare system in the world. But we also have a significant opportunity to address this inequity and unlock the potential of 52% of the population. So we took our message to the world at Davos. And since then, we've been thinking about, we have this village, we have the opportunity to really enact change. And today, you're going to be hearing from a lot of the members of this village, a lot of these signatories that put the organization and the effort and the enthusiasm behind this community that really wants to drive change. Coming up, we're going to be speaking with a number of individuals from our amazing signatory community that, as part of their organizations or as individuals, are driving incredible advancement and change in women's health. First up, we spoke to Dr. Sara Saeed, the founder of Sehat Kahani, the largest telehealth provider in Pakistan, who has an incredible story about how she took equity at the center of her organization, not only to provide care for women, but also to bring the amazing talent of female doctors in Pakistan back to work. So Sara, thank you so much for taking the time to talk to us today. And it's amazing to see you after a wild time at Davos. So if you don't mind, it would be great if you can introduce yourself and the work that you do in the space of women's health.
Sure, thank you. It's great to be connected again. So my name is Dr. Sara Saeed Khurram, and I'm from Pakistan. And I run a female-led telemedicine organization the vision of the company is to provide democratized healthcare access to all using technology. In Pakistan, we're connecting a large network of women doctors who previously left work due to social-cultural barriers, often becoming doctor brides, and we connect them to patients across Pakistan using a chat, audio, and video consultation platform that allows a patient to do consultations, access medicines online, get connected to labs, manage their medical claims, get referred to tertiary care hospitals. So all in all, a one-stop primary healthcare shop, which is accessible to not only urban users in Pakistan, but we also make clinics in low-income areas where patients can walk into centers and get connected to an online doctor through a nurse intermediary. Sehat Kahani today has a network of 63 e-health centers in low-income areas of the country. Our app is used by 1.5 million users, and we're also serving 860 plus corporates for B2B services. 90% of the footfall in our clinics is women and children, because I think our clinics and our app has been able to provide a safe space for women to get consultations for sometimes very taboo issues that they might not get doctors for. Also, I think we've created a very safe community for female doctors to come and practice online. But majority of the cases that we see in our clinics are related to sexual and reproductive health care, early pediatric issues, infertility, family planning, unexplained menstrual bleeding, and all of these issues are handled by our doctors in extremely low-income community settings through nurse intermediaries.
Sarah, it's just so inspiring to hear you explain the work that you do at Sehat Kahani, and in so many areas, right? First of all, because you have created a service and a system that is going to transform care for so many women that before wouldn't have access to it. Or if they had access to it, they would have felt in a place that wasn't right for them. And also, you've kind of given this incredible opportunity for women in the workplace that otherwise would have been potentially just taken outside of the medical profession. So it just ticks so many of the boxes, and I can't imagine how this model can be just translated to so many other markets that are going to be suffering from some of the same kind of stigma and access barriers that you're seeing in Pakistan. And Sarah, what motivated you to start this? What was the kind of original kernel of the idea behind it?
So as I mentioned, 80% of the workforce in Pakistan is women. We have 240,000 doctors, and good 80% of our workforce is women. But unfortunately, only 50% of female doctors ever practice, because a lot of them are made to choose between career and family at a very nascent stage, and often many choose family over career. So 50% of our workforce actually sits at home, not contributing to the medical ecosystem. They are called doctor brides. There's actually a name for it. So right after my graduation, I became a doctor bride. I got married. I tried to continue my education, but I had to quit because I got pregnant, and I had to sit at home due to complications. So while sitting at home, I started doing a clinic in a low-income area in Karachi, which is where I live. And I used to go there every day, and I used to provide consultations. When I had my daughter, I had to move to another city, so I couldn't practice there. And they didn't find a doctor to replace me. So I got a call from them while I was in Lahore and the clinic was in Karachi. And they said, what should we do now? You're not coming back and we can't find a doctor to replace you. And I told them, okay, when a patient comes to you, take me on call. And eventually the nurse in the clinic said that, this is not working. The patients need to see you. And one day we shifted to a video camera. And I realized that, okay, I'm sitting in Lahore, the patient is in Karachi, and we're connected through technology. Why don't we create a platform in Pakistan that connects all women doctors to patients and solve this big gap of two challenges together through technology? So it started with that one incident. But when we started practicing and when we started providing our solution in low-income areas, we realized that the problem we are solving was extremely huge. The solution that we have created has such immense potential because we were able to identify patients with long-term infertility, people who had long-term diabetes and hypertension, people with cancers we were able to identify on video camera. And I realized that this solution is not only just for low-income areas, but everyone in Pakistan needs it. And that's when we created the app so that every smartphone user in Pakistan can download and connect to an online woman doctor.
It's absolutely incredible, and it's just a solution with equity just like truly built at its core from all angles, and such an amazing example, Sarah, of going from ambition to action, which is a lot of what we want to do through this community. I think we've kind of galvanized a lot of information, a lot of data, both about the problems and the inequity that exists, but also about the economic and moral opportunity that exists out there in kind of closing the women's health gap. But I think your example just like articulates it so beautifully, that you saw the opportunity, you saw the challenges, and you've used tools that exist and are out there, and you've created something that has just transformed the care and the lives of not only the patients but also those doctors that are now back in the workforce. It's really truly just an incredible story, and I think that something that as well you can take away from Pakistan into other countries as well. Final question from me: what are you most excited about as you think about the years to come in this community and what it can achieve?
What I'm really excited about is I think there's a lot of talk on women's health, but as you said, we don't see a lot of cohesive action. So I think initiatives like this give an opportunity to someone like me who comes from Pakistan, talking to you, connecting really opposite worlds together, really focused on one purpose: how can we redesign women's health? And I think that's the real beauty of such conversations, such actions, such organizations, because it takes into perspective a global phenomena, and it has a trickle down effect. If me and you are talking today about redesigning women healthcare, this will have a trickle down effect years from now into the healthcare system of Pakistan as well. I know that, and you know that. So I think that's the bigger picture that initiatives like these bring.
Next up, we spoke to Teal, the head of the Women of Childbearing Age mission at UCB, who have been pioneers in including women that are pregnant or lactating into clinical trials for their products. So welcome, Marie, from UCB. We're really excited about having you with us today. So if you can tell us a little bit about yourself and what you do, and then we'll get into the conversation.
Thank you so much, Paula, for having me here and for the opportunity to this fireside chat. I'm Teal, and I'm leading the Women of Childbearing Age Program at UCB. So on this very international, important Women's Day, UCB rallied behind the global call to inspire inclusion, which for us is an important message that we proudly support across our organization. So just to give you a little bit of background, you may be aware that UCB's main focus areas of interest are neurological disorders like epilepsy or myasthenia gravis, and also immunological disorders like inflammatory chronic diseases, rheumatic diseases, psoriasis. And many of these chronic conditions are more common in women than men. This is why UCB has been long-standing committed to understanding the unique needs of these women with chronic diseases and to improving their standard of care. And we are inspired by patients. So we always start by listening, and we listen to these women. And I just want to give you a few examples of what we heard. In axial spondyloarthritis, for example, research shows that women can experience longer delays in diagnosis, greater pain, anxiety, and stress. And ultimately, that can result, as a result, can be less active. In psoriatic diseases, another example, it's a disease that affects both skin and joints, and women experience a greater feeling of stigmatization. They're more likely to suffer from stress, loneliness than men. Another area that is very dear to us is osteoporosis, and 1 in 3 women will suffer from fragility fracture during her lifetime. It's just unbelievable. And what is more unbelievable is that despite these specific needs, policies and frameworks that support an equality-based approach to the care of women are still limited. So at UCB, we believe that everyone deserves to live the best life they can. We're focusing on creating valuable health solutions that improve the lives of these women living with chronic conditions.
And this is amazing, Marie, because this is exactly what we were trying to talk about in the open letter, which is sometimes we think about women's health through the lens of it's just reproductive health. And the pioneering approach that you have taken is that if you look at some of those chronic diseases that you're describing, they disproportionately affect women. They also manifest themselves differently in women. So we need to think about how are we diagnosing. But also just the diagnostic journey for women is completely different to that of men. It can be filled with bias, it can be filled with stigma. So just by taking this much more broad approach of what it means to be working on advancing women's health, I think you're going to be touching lots of areas of inequity that really need to be addressed. So it's an amazing example of how, as a company, you've gone from the ambition of just advancing women's health and putting patients at the center to actually some really tangible actions is really great to hear.
Yeah, and even more tangible, Paula, as we're driven by science, one key area that we focus on is the underrepresentation of women in clinical trials and its significant negative impact on women's health. So our commitment to inclusive data generation enables us to provide more accurate and more personalized insights, ultimately empowering these women and their healthcare professionals to make more informed decisions across a spectrum of health conditions. But more specifically, I would like to focus on the critical needs to address the lack of understanding regarding medical decisions during pregnancy and breastfeeding. And our dedication to resolving this issue reflects on our broader mission to empower women living with chronic diseases through factual and inclusive decision-making during this very unique time of their life. And we believe we should accelerate our collective effort for these women. So at UCB, we started 10 years ago to work on providing high quality data for women of childbearing age living with chronic diseases. And we worked, as you said, with key stakeholders to address the unmet needs of patients before, during, and after pregnancy, but also we were the first pharmaceutical company to conduct clinical research and to generate strong evidence in women with chronic diseases during pregnancy and breastfeeding.
That's incredible. And because it normally would be a no-go area. And we've seen that in clinical trials of the past where exclusion criteria would immediately take out women that are pregnant or are breastfeeding. But then you're leaving a lot of patients out there that are potentially going to have to make choices about, do I look after my disease or do I build a family? And those are choices that in an ideal world, women wouldn't have to make. And I think it's just fascinating work. Again, the UCB has pioneered by putting patients at the center. And I'm hoping that other pharma companies in the collective scientific community can start to learn from this so that we don't have to make those trade-offs and we don't have to make those choices, and we can support women in the desire to bring the next generations that we all need, but also at the same time look after themselves when they will be going through very challenging circumstances living with a chronic disease.
Absolutely, absolutely. It's our wish too. And actually, our research program that started with chronic inflammatory diseases is now expanding across all our current and future areas. And really, the primary goal is exactly what you're saying, Paula, empowering women facing these chronic conditions during their childbearing years for them to have the necessary information for informed decision.
And Maria, question there. There's only so much that a company like UCB can do. You need community, a little bit like the one that we're building here. So what have you learned over the past decade as you have been championing this cause of working in coalition?
So indeed, what I've learned is that we cannot do it alone. And we need to partner. And this is fantastic to be able to partner with patients, with scientific communities, with regulators and policymakers, because only all together we will be able to advance the scientific understanding for these women. And to that point, I just want to mention that as the co-chair of BRIDGE, which is an independent global commission, and BRIDGE stands for Better Research, Information and Data Generation for Empowerment. I look forward to continuing to support women's ability to make informed decisions about their treatment, from diagnosis of a chronic condition to their reproductive health journey. And this is exactly what we've built with BRIDGE, a group of patients, regulators, scientists, scientific community, all working together, ethicists, because you mentioned earlier the clinical trial, very important. How can we do that ethically in the future? And our goal is to deliver practical and action-oriented solutions to bridge these information gaps affecting women during this time of their life. And I'm looking forward to sharing with you a detailed report on these practical actions, and should be coming soon, May 2024.
Next up, we spoke to Meenakshi Vajpai, the Vice President of Customer Engagement and DEI Chairperson for TechMahindra in Europe. So welcome, Meenakshi, and thank you so much for taking the time to talk to us, and also for being a signatory of Open Letter. It's really great to have TechMahindra. So if you could introduce yourself and tell us a little bit about your role to start with.
Thank you, Paula. Thank you for having me here, and delighted to be part of such a noble initiative. And whatever little way I can contribute, I'm very, very happy to do so. A little bit about myself. I am actually 30 plus years in the IT industry as an IT professional, practitioner. I've worked with several telecom companies like Vodafone, Airtel in India, Vodafone Turkey, and now I'm for the first time driving the service industry in TechMahindra. And my role here is to look after a client called Telefónica. But I am here in my capacity as a chairperson of the DEI initiative in Europe.
Fantastic. And what an amazing career. And also what a great role to drive equity when it comes to companies like TechMahindra and driving equity in the tech industry. So fascinating. So from your vantage point, Meenakshi, if we think about at TechMahindra, you've got very many gender equity initiatives as an organization, and you're supporting both your employees, but also the communities that you serve. But when it comes to health equity, can you give us some examples of how you are moving from ambition into action?
Interesting, because we all talk about ideas, we talk about plans, but Paula, for the first time, somebody is talking about action, talking about specific pointed initiatives. I love this. India is very different in many respects in terms of the urban-rural divide that we have. Usually, it is not so big in European countries that I'm seeing. In the way the social challenges need to be tackled, the hesitation of women specifically to come forward with their problems, the dependency of the women on somebody else for their healthcare, and I can go on in that manner. So for us to address healthcare for women specifically, I'll talk about, but what I'm saying will kind of be applicable to all genders. We need first a comprehensive approach, and definitely a multidimensional and proactive approach. What we are doing is in 3 areas, Paula. First is access. How do we ensure, specifically in the rural areas or in the lower strata of the urban areas, how do we make healthcare easily accessible to everyone? The second aspect is how do we educate people more and more not only to understand and address the problems that they potentially might face, but also for them to become more independent. And we'll talk about this a little later on how that pans out for us to paint the big picture. And the third, of course, is community and social support that we need to provide for them. Within TechMahindra and in the community that is around us, we talk in terms of health talks. We just pick up a topic every other week and we just talk about it. We call in the experts and we just get into a Q&A mode after the first round of download. It covers mental, physical, emotional, environmental, occupational well-being. All of those dimensions have to be addressed if I have to talk of a well-rounded well-being addressal. I don't want to start rattling off the statistics, but it drives our priorities, right? If we talk about, for example, for women, breast cancer, 1 out of 7 women are diagnosed with breast cancer in the lifestyle that we are leading. We get data from CDC, we get data from NCD, and we try to, WHO, of course, and try to kind of prioritize the initiatives that we are taking. So cancer definitely is one of our big ones, other respiratory diseases, etc. But we also want to focus very specifically on, menstrual health, because in India, that's not a small thing. In India, and it's being much talked about now, it is not even considered as a health hazard. Being careless about that or being unhygienic about that is not even considered a health hazard. So we specifically run programs around that, even though there's no data available around that. We try to create, non-invasive screening techniques because we want to eliminate hesitation from women, for women. We want them to come forward and talk about these things, especially in the rural areas. There is so much of hesitation in talking about, especially, menstrual or pregnancy-related or any kind of sex-related disease. And these are things they don't want to talk about. So we want to make sure it's non-invasive. We want to make sure they are encouraged to come forward and talk about that. The second aspect, of course, is mental health. Getting bigger and bigger in the urban areas, especially, and not that much talked about in our country. Internationally and in the urban areas now, in the upper echelons, people are talking about it. But otherwise, as people hesitate, they don't talk about it. So therefore, making it comfortable for them to come forward and talk about them. Gender-based violence related, and I don't want to digress on this topic of gender-based violence. I want to talk about the mental health as an outcome. Implications of that, and how do we address that? We want bring it out in the open, and we talk about that. Huge challenge to get people to come forward and talk about it. Across different stages of womanhood, as you know, as girls are growing up at different stages, what are the different kind of challenges they can face? And then how do we build a supportive environment to make sure that, they are comfortable to talk, get the right people to talk to them, get them to kind of get away from their environment of hesitation, etc., etc. And the third part, which is very common but very, very important, is maternal and reproductive care. These have got larger social implications as well, but equally applicable for healthcare and well-being. So they need to be talked about. Unsafe abortions need to be talked about. So we bring out these topics in the open for them to be able to get comfortable, and we give them the support, the information required. And that is a good segue for us to talk about education. How do we educate them about what to use, at what point? How do we educate them to talk to the right people? We set up specific programs that can proactively raise this awareness and the preventive care for these people.
What it really highlights is that we have a bit of a global north and south divide on this topic, where in the global south, it's just so much more fundamental, the level of challenges that we have, because it's all around education and awareness in the first instance of women's health and the education of women and society on these topics. Then there is the access piece, which even if I'm aware, accessing the right level of care might be really challenging. And what I love about the stories that you've told is that employers, especially in large corporations like Mahindra, have got a real responsibility in both addressing the education side of things and the access side of things. And it sounds like you're doing wonderful work across both areas, and is very necessary in some of the lower middle income countries, that we can't leave it all to the governments because resources are scarce, and the private sector can come in and play a real fundamental role in advancing women's health in all of the ways that you have described. Is really encouraging to hear. Next up, we spoke to Chris Wigley and Cecilia Lindgren, the founders of a really exciting startup called Aneira Health that wants to completely redesign care and create specific pathways for women here in the UK. So welcome, Chris and Cecilia, and it's really great to have you on board as part of this conversation. And thank you so much for being a signatory to our open letter to redesign healthcare with women in mind. And as we come together today, we want to start to talk about how do we go from numbers and reports and words that we've been doing a lot of to actually rolling up our sleeves and getting some stuff done on the ground. So it would be amazing to hear from you. So you have such a clear vision for Aneira Health to create a new health service that has women at the center. So can you give some examples of the first steps that you're going to take so that this really happens?
Yeah, great. I can go first. So I think it's really important to focus on this with a holistic sort of view in mind and not coming from a point solution angle. There's almost 1,000 apps and point solution out there for women today, but they're not really solving the problems. We think that women really need a holistic approach that supports them through the entire sort of life course from puberty to menopause and beyond that. We want to keep women healthy rather than managing late stage disease. And if someone is sick, if the woman is sick, we want to get her healthy again. It takes more than an app to do that. So we believe in digital first, but not digital only.
Yeah, and I think a big part of our thesis is that here we are in 2024 with all of this amazing science, all of this amazing technology, and we need to bring this to women, to patients of all kinds. And many of the approaches that doctors and clinical teams are taking today haven't changed in decades. So we really want to innovate on those pathways. We want to make them much more data informed, analytics informed, and use all of the tools that we have at our disposal in 2024. And I think another angle that is true today that wasn't necessarily true in the past is that we've all become used to kind of consumer grade services. So slick, multi-channel, highly efficient ways of getting things done. But in healthcare, we've come to accept these services that are so substandard compared to the experience you have when you do your shopping, when you do your banking, even something like managing your utility bills. So we want our members to have the same contemporary kind of multi-channel experience with them and their data at the heart that they kind of rightly expect in other areas of their lives. Healthcare should be better than those other services, not worse.
And when we think about healthcare, for us, it's really important to think about clinical teams as important as patients. They're also underserved and struggling today. And if you look at the current contemporary sort of solutions available, clinicians aren't doing well, nurses aren't doing well. And that's a true across the entire board, but particularly in women's health. So the waiting lists in NHS today are the longest for women's and reproductive health. And it's shocking that most doctors and nurses today have only had a couple of days trainings on women's health in medical school. So we really want to invest in the right system, the right training to ensure that our clinical team can operate with care and confidence at the top of their license and actually spend time with the patients and not doing a bunch of admin and not struggling as they are today.
That is amazing, and it's such a noble cause, and is a big one. And I'm going to throw a question that I hadn't given you guys before. But as you're sitting there, the ambition is really big. What are you most excited about as a team? That I guess is what motivated you to start Aneira Health. But also, what are you most concerned about, kind of so early in your journey?
Yeah, it's a great question, and maybe I'll have a crack, and then Cecilia can build on it. I think, for me, the opportunity to build something greenfield is so exciting. That so many of the large healthcare systems, whether it's in the UK, whether it's in the US or globally, are dealing with so many issues of legacy. And we have so many incredible tools at our disposal, and including all of these amazing emerging capabilities in AI that are really exciting to explore, that the idea of building something which is not hampered with that kind of legacy is amazingly exciting. And you could almost say that same thing is the most scary as well.
Yeah.
Because the scope of it is so potentially infinite. So we're trying really hard to discipline ourselves in terms of, restricting our initial scope in terms of geography, clinical areas, and so on, so that we can bite off something that's manageable.
And I think, just building on what Chris says, that lends itself as a platform to have true impact for women and girls today and really make a huge impact on their lives.
Yeah, I can
scary.
feel the energy. Yeah, and scary. But if it's not scary, is not going to be exciting at the same time.
It's not worth doing.
Exactly. And team, as we think about this growing community of 60 plus organizations now, but really 100 that are kind of coming closer to do something. there's so much that we could go after. So what do you think that we should prioritize as we stand up this community and the work that we want to do over the years to come?
I can start with that, and maybe Chris can build on it. But I think one of the key things that we see, and something that this is a part of, is actually building communities of women. Women are amazing at supporting each other, and there is a lot of different groups available for a particular point solution or age-specific issues or particular conditions. And if you look at the consultation that the government did in the Women's Health Strategy, women listed as a key top priority to get help from communities of women facing the same issues as me. And I actually think that this is a really important way to help women manage their health. And we need to make it easier for women to find each other, to grow and sustain these communities, and also empower the communities with proper knowledge-based, factful information that is easy to digest and easy to retain for people. Yeah,
and maybe coming from a kind of completely different angle, I think that another element that this incredible network that you're developing can really influence is bringing really dedicated finance to this issue. Aneira is a new venture. We've been talking to lots of investors over the last kind of 6 months, and as Andreessen Horowitz and many others have pointed out, this is a huge opportunity as an investor, but to many investors it still seems somehow niche. We've had lots of investors ask us, oh, why would you focus on only one segment of customers? It's like one segment, 51% of the population is in almost all cases the main decision maker for family health as well. And so I think we need investors who understand the space and the vast opportunities, and then our collective part of the deal is we then need to build companies in this space that are so compelling that all of the other investors will be fighting to get into the action, and we will be having the impact on this issue, which is so persistent. The kind of impact that you can see from space that will really change the lives of women and girls across the planet.
Next up, we spoke to our partner in crime, where it all started, Oriana Kraft, who's the founder and producer of FemTechnology. Thank you, Oriana, and it's great to have you with us today. We've been on a hell of a journey together on this open letter. So now it's time from the kind of the bold ambition that we set out into actually rolling up our sleeves and start work. So as you think about that, what would be the areas in which you think that we're already moving from ambition to action in your experience?
Well, I think a lot of the reports that came out of the FemTechnology Summit, of which you were a part of, are definitely moving from ambition to action. I mean, we brought together innovators and experts in the field to sort of tackle collective pain points in women's health, and one of which was sort of this pledge, right, on redesigning healthcare with women in mind that came out of it, which is really a huge call to action in terms of getting companies to concretely commit to doing something for women's health. I think another amazing step we took from moving from ambition to action was outlining a vision of what women-centric cancer care could look like, which is actually being presented at the U.S. Chamber of Commerce this week. Wow. And sort of, being showcased to employers about what that could look like, what that should look like to deliver standard of care. Also financing innovation in women's health, did a whole white paper on sort of what those models and pathways should look like. So I think the first step was bringing together different experts and really understanding that we all have our role to play. And then, co-creating, that was the initial first step. And then now it's seeing how can that be carried forward. Yeah.
Amazing. And it's been so great to see that it was a different kind of summit. I had never been to one like that before, where instead of like sitting down and then just listening to people just regurgitate the same facts about women's health and all of the failure points and the opportunities, it was actually just that co-creation element that I think got a lot of things going, which is super exciting. And I think the kernel of more action that can come out of our community. And if I think about that, then Oriana, and kind of how we may partner going forward with FemTechnology, with innovators, with pharma companies, with private equity, what do you think should be the big things that we focus on as part of the community as we stand up the work in the coming weeks?
Well, I think it's really the sort of leveraging of collective knowledge, because I think there's a lot of conversation around the lack of data in women's health, which really translates to a lack of information, right? Lack of research, lack of knowledge. But I think what we found, right, at least with FemTechnology, is there's a lot more already out there that we're just not talking about or putting the pieces together and weaving it in an interesting and powerful way. So sort of leveraging what is the expertise of clinicians that are sort of on the ground? What are researchers seeing that's just not being translated? What do pharma companies know? They have a tremendous amount of insights and have done research sort of in silos, and they have sort of a collective interest when it comes to women's health in terms of coming together and saying, this is what we know, this is what we don't know, this is where we need help. So for me, it's really bringing those different actors together, those different pieces, those different amounts of information to see how can we weave it together into like a really interesting tapestry, into a movement, which catalyzes change.
Amazing. And what would be your biggest worry as you look ahead? Because the problem is so big and it's so complex. What are the things that we need to be watching out for as we embark on this journey together?
I think that it's not all talk. I think talk definitely has a role, right? The first FemTechnology Summit was sort of awareness raising, unconsciously, right? I was a medical student and I didn't know about any of these diseases, and it's not normal that you should be introduced to diseases like endometriosis or PCOS, which impact 10% of the population for the first time in medical school, right? If I had those problems, I wouldn't have known to go seek help from a doctor. And then if I did, with a disease like endometriosis, I might wait an average of 7 years to get diagnosed because the time allotted in medical school isn't sufficient. So there definitely was a need for conversation around it. But now I think we've sort of reached that point, right? Where I'm here in London, where like in the tube, you see ads for menopause plastered everywhere. We're having that conversation. So now what comes out of that conversation? How are workplaces going to shift their policies or benefits to better support women? How are pharma companies going to develop more assets that for these diseases or diagnostic tools? How is medical education going to shift to reprioritize women's health, to understand that also it's not just reproductive health, but that there are differences in terms of cardiovascular disease and actually in every organ system in the body. So that would be the danger, I think, is that it's really nice and easy to sort of pinkwash, and it's harder to do something. I think there's a willingness to do something. And now I think our job as a community is to say, this is what needs to be done. And this is how it can be done because I have this expertise in the pharmaceutical industry, in venture capital. I know this, and this is how it comes together. Yeah.
Amazing. And final question from me, Oriana. Fast forward 3 years from now. So we're in Davos, let me think, 25, 26, 27. So it's 2027 in January. What would you like to be able to say at that World Economic Forum 2027 after 3 years in this community?
After 3 years in this community, I would like to showcase all the work that will have been done in those 3 years. I think there's a lot we can accomplish together. I would like, and I would like, actually, I think there was a quote, it was from like the Amazon CTO, where he talked about how women's health could actually leapfrog healthcare in general. I think why not have women's health be sort of like an emblem and a standard of care to aspire to? We have all these tremendous innovators. I think we should do it right from the get-go. We have the chance to rebuild it from scratch, right? So I would like to say, oh, we embedded all these innovators. We saw all these collaborations between more established companies and sort of research. And yeah, hopefully there would be some action from countries as well. That would be tremendous. But yeah.
Yeah, it's super fascinating. I was speaking to some of our other signatories that are sitting in the lower middle income countries, and how right now the ask from governments is probably just too tall, because there are fundamental issues in the healthcare system across the board, let alone when they start to think about gender equity. But there's a real opportunity for employers, like you were saying earlier, to just take a stand in some of those LMICs, so that we don't end up with trying to drive inequity out from a gender perspective, but we do it in an inequitable way, because we're doing global north and global south at different paces. But lots to discuss, I think, in our community going forward, and how can we advance this for all of us. But thank you again, Oriana, for being a partner, and we look forward to continuing our work together in the months to come.
Thank you for having me.
Next up, we spoke to Dr. Antonella Santuccione, the founder of the Women's Brain Project. So thank you for joining us, Antonella. It's a pleasure to have you with us today. And thank you again for being one of the very active signatories of our Redesigning Healthcare with Women in Mind community. Would you mind introducing yourself and telling us what you do in the Women's Brain Project?
Thank you so much, and with pleasure. My name is Antonella Santuccione Chadha. I'm a medical doctor and neuroscientist, and I am one of the co-founder of the Women's Brain Project. Our organization started already in 2017 to generate evidences as why sex and gender matters when doing clinical development, when diagnosing patients, when understanding how disease might affect men and women differently. So we have been contributing to this discussion since then. We have been pioneering actually the work by publishing at least 100 peer-reviewed scientific publication, and we've covered diseases like Alzheimer, like migraine, like Parkinson, even COVID and cardiovascular diseases, trying to really understand the sex and gender perspective of things. What we've learned is that men and women disease differently. They experience symptoms in a different fashion. They have different time to diagnose. They have different type of treatment response, and this requires a careful look. So we are, on a journey. My work is supported by 60 plus pro bono scientists that are contributing to all the evidences I've shared already with you, and we are continuing, embracing also the part which relates to biases in novel technology and AI machine learning application for health, of course.
It's such fascinating work, Antonella, and I always love when you use the term that we need to move away from saying that women's health is bikini medicine. Is so much more than that. And all of the work that you're doing is exactly to that point, that we do not understand female biology in the same way that we do that of man. Women's brains are not just smaller men's brains. They are just completely different physiologically and biologically. So I'm super excited about the work that you guys are doing, because it's from that ambition of getting to better understanding of female biology to actually action. So can you give us some examples of how you are doing that?
Well, I think that all the success we had so far and what we want to do further does not happen in a silos. So the biggest learning is that the change comes, first of all, from within the sector that you're trying to engage with, meaning pharmaceutical company, but also regulators, investors, agency that decide where to allocate the funds for research. So if you bring all those different type of stakeholders around the table and start a discussion, then the change is going to happen. And to a point, Paula, that we can say that from where we began till today, we're talking of establishing the first sex and gender precision medicine research institute in the world. And, I'm sure you have heard, everybody has heard, the Institute for Cancer Research, the one for immunological disease, the one for tropical diseases. Why not to have a research institute better studying and understanding how sex and gender impact diseases and treatment response, and have, of course, a virtual, broad global reach out and distribute the learning to everyone involved, as we said, from drug developers to finally the patient, because what it matters the most, it is the patient and who is going to prescribe the right drug at the right moment for the right patients in front of you, whether man or woman. And that's what we're doing. So to have that first sex and gender precision medicine research institute established, I hope it's going to happen. It doesn't happen alone. We have to have the synergy and the interest of all the possible stakeholders involved to benefit women and men all over the globe.
That's amazing, Antonella. And that brings me back to the topic of this women's health village in this community, on your point about we cannot do all of this alone, and it has to happen as part of a really broad network of stakeholders. So as you think about just this community that we started to create back in 2023, what are you excited about being part of this community? And also, what are the 2 or 3 things that you think this community should focus on?
I mean, what really makes me excited and have hopes is that we have all different types of stakeholders around the table. And it's also about policymaking, because policymakers are the ones that, again, allocate the funds, governmental funds, to make the change in terms of infrastructures. And if you want to speed up diagnosis, recognize specific symptoms, bring the right treatment, you need to have a change, as we said, also to a structural level on the ground where patients get treated in the private or public sector. What makes me excited is also that I'm sure the common voices and the common efforts will generate the funds needed, because I think it's also an area where we need to be brave and motivated enough to allocate the funds needed. It's not just about advocacy, it's not just about research, it's really getting the money to make the change happen as soon as possible. Someone asked me in the past, why are you so much in a rush to make your institute happen? And my answer was, at the end, because women die. I mean, women do die because of the wrong treatment. The fact that polytherapy often brings to a high, to side effects which are lethal for women. I want to mention one work done by the General Accounting Office in the United States in 2001, and since then nobody dared to make a follow-up study of this kind, and I would love to have the funds to see what happened since then. But that report pointed to the fact that out of 10 drugs withdrawn from the market, 8 were withdrawn because they had the lethal side effects, mainly in women. So again, women are under a threat and under a risk that we have to mitigate as fast as possible, because it's not just about having a nicer drug, it's just saving life.
Fantastic. Thank you so much, Antonella. We're very excited about continuing to work with you and see how both the community and us ourselves in Kearney can contribute to both the work in the Women's Brain Project, but also critically the institute that you're looking to stand up. So thank you very much again. Next up, we spoke to Jeewa, the Diversity, Equity and Inclusion Strategic Advisor to the World Health Organization Foundation. So Tia, thank you so much for joining us today. Jeewa is the advisor for DEI for the WHO Foundation, and she's going to be telling us about the amazing work that the team do and how they are advancing health equity and women's health. So welcome, Tia.
Thank you so much, Paula. It's a pleasure to be here.
So could you tell us a little bit about the work that you do within the foundation as the advisor for DEI?
Absolutely. So I'm the special advisor for DEI at the foundation. I've been here for over 3 years. What I do is a lot of work internally, so looking at how we can broker health equity stronger and further, from raising awareness, from training, inviting speakers, looking at gender parity across the organization, to also interrogating a lot of our global health solutions to ensure we are reaching the communities who need them most.
Amazing. So in all of these health equity initiatives that you've been driving, obviously we're very focused on gender health equity as we're trying to redesign healthcare with women in mind. And we've come to a point where we've all been publishing lots of reports and talking a lot about the issues and the opportunities, but really it's time to kind of roll up our sleeves and get into action. So could you give us some examples of how you think in the WHO Foundation of how to go from that bold goal to drive gender health equity into real actions on the ground?
Absolutely. So we do this twofold. I would say you start doing the work internally, some raising awareness, from training to looking at supply diversity and gender parity across all levels of the organization. Pleased to say we're on track for that, but also interrogating our global health solutions where we're supporting WHO, specifically with the gender lens. So to give you a couple of examples, we know that the gender health gap is much wider in low and middle income countries, where women experience nearly 40% more years living with ill health. And we also know with that statistic that a lot of that is around poor maternal health outcomes and high rates of complications during childbirth. So that's why we want to take a really strong look at what are these issues and how we can solve. So within that piece, we've been concentrating a lot in supporting WHO with regards to emergencies. So that's Ukraine, that's Turkey and Syria, that's the Horn of Africa, Sahel and Gaza right now. So that's assisting with medical supplies and services, that's looking at maternal and child health, to sexual and gender-based violence and psychosocial counselling. But we're looking more broadly also within the climate and health portfolio. So that's looking at electrification of healthcare facilities in Africa with a very strong focus on maternal and child health. And also looking at digital health, where we're looking at gender responsive solutions, looking at how AI can be really beneficial in empowering women and girls, particularly around sexual and reproductive health rights information. So tackling disinformation, making sure that they are getting non-judgmental information and making really informed decisions around their health.
That is amazing, Tia, and it resonates a lot in so many ways. We've been speaking to some of our signatory colleagues around the difference between the developed world and the LMICs, and how it starts with awareness and education, almost of the right for them to demand healthcare, and then into the access piece. So is really incredible work that you guys are doing on the ground. So we're delighted, obviously, to have you as part of our community, because we would run the risk of make this very global north based, and it needs to be equitable across the world. So we're delighted to have you. And as you think about the community that we're standing up of those kind of 60 signatories and 100 organizations, what do you think the areas that we should focus so that we truly accelerate gender equity in healthcare?
Absolutely. I think there's a number of things we need to do. We need to disrupt the status quo, and we really need to reshape how women experience their health, and we need to change it for good. And I think there's several things we can do. Number one, we need more advocacy in women's health. We need to influence both the global and local health agendas. We need to focus on scaling integrated health innovations so more women and girls can make informed decisions and take control of their health. We need to ensure that all of women's health programming does take a life cycle approach. So we're looking at fertility, we're looking at endometriosis, we're looking at menopause, and we're looking at community and age-specific health conditions. We also need to challenge a lot of the stigma that's out there. We need to look at parity both in teams, in products and clients and our investors. We need to really radically improve medical knowledge and reduce the bias that's out there. We also want greater participation of women and girls in science and tech. We also need to diversify the data. So we want to ensure that that data is tailored to women's needs from different communities. We understand their barriers. We also want to ensure that there's good data security around that data, and a lot more investment in R&D. We want to see more participation in clinical trials. We want to see more investment in this space, in venture capital, all throughout the innovation cycle. And we just want to ensure that there's greater collaboration and partnerships. No one organization can do this on their own. And I think it's about building a movement so that we're making transformative change. We really are bridging the gap for women.
Amazing. Thank you, Tia. And I'm hoping that we have just started this movement with the open letter and all of the organizations that are on board. And now we just very much look forward to rolling up our sleeves and starting work with you and the rest of the community members, so that when we come together in International Women's Day 2025, we've got a lot of great stories to tell about how we advance women's health in the world.
Thank you. There's a lot of action we can take, and the time starts now.
So I hope that you agree that was a fascinating set of fireside chats with some of the leading innovators, doers, and thinkers when it comes to women's health all over the world. And you might be wondering what happens next. So what we want to do is continue to grow this community. You've met a few, the 60 plus organizations that are part of our movement, and we want to continue to grow this because there's plenty of work to be done across overhauling medical education, transforming research and development, making sure that we create care pathways and care delivery models that put women at the center, and also that we start to increase the level of investment that is going into women's health as a whole. And this community is going to start to roll up their sleeves and start to come up with actions within each of the organizations, also with the opportunity to share across organizations on what some of the best practices might be, and then critically starting to come up with solutions, innovations, and new business models in areas where we have the highest unmet need in women's health. for example, in reproductive health, in women's cancers, in heart disease, in neurodegenerative disorders, and in autoimmune disease. So there's a lot of work that's going to be happening with this community. We're excited to get started as soon as in the next few weeks, and we look forward to welcoming you and any other organizations into this movement. If you want to take part, if you want to become part of our village, please email us on womenshealth@kearney.com. Thank you very much for your attention, and I look forward to advancing the agenda of women's health together with many of you.